Good morning. Today's class is of extreme importance both clinically and for theory. It is one of the very useful clinical tests that we can do in the OP without much instrumentation, and also pupillary examination goes a long way in explaining several systemic conditions and helps to provide diagnosis not only for ophthalmic diseases but also for other autoimmune and infectious diseases. So, I would just like to start with explaining a little bit about how the pupil actually is formed. It is essentially made of two muscles forming an aperture. So, these muscles are iris muscles and they are divided into two groups. A circular group of muscle which is called the sphincter pupillae and a radial group of muscle which is called the dilator pupillae. So, it looks like this. If this is the iris surface, and the pupillary aperture, actually the pupillary aperture is formed by these muscles. You have the sphincter muscle which is present just around the pupil in the peripupillary area, and this has a circular that's why it's a circular group of sphincter muscle, and we have the radial group of muscles which is called the dilator pupillae. So this junction that you see is called the collarette. The collarette indicates that it is a junction between the circular and the radial group of muscles, or in other words, the sphincter pupillae and the dilator pupillae. So, it is the interplay between the sphincter muscle and the dilator muscle which actually coordinates pupillary dilatation or pupillary constriction. The normal pupillary size is about 3 to 4 millimeters, and we also need to know certain terminologies. The word polychoria refers to more than one pupil. So, normally if the pupil is supposed to be present only in the center, presence of another aperture is called polychoria. And the presence of correctopia is the presence of an abnormal or eccentric pupil. Both these conditions are present in a type of glaucoma which is called iridocorneal endothelial syndrome, which we will discuss when we're talking about glaucoma in detail. But essentially, it is a consequence of iris atrophy or so many processes that can lead to iris muscle getting weak and, forming these multiple apertures. So, one of the very important tests that we perform is light reflex. The light reflex means we are showing light onto the eye and eliciting a pupillary reaction. So, this direct can be divided into direct and consensual light reflexes. The direct reflex is when we shine the light directly into the eye, as the name indicates, and the consensual reflex is when we shine the light and look for the reaction in the consensual or the opposite eye. So, these two form the key in evaluation of a pupillary light reaction. And we have another test which is called the swinging flashlight test. Swinging flashlight test, again like the name indicates, the pupillary light is thrown. The pupillary light is thrown on both eyes and we look for the reaction. So, this light is thrown in an alternative fashion between the right eye and the left eye, and we elicit the reaction. I will be demonstrating all these reflexes to you shortly. And we also have to elicit what you call a near reflex. Now, the importance of near reflex and light reflex is that in near reflex, it is believed that this center is located more ventrally and this center is more poorly defined. So, it is always important for us to remember that the pupillary light reflex is better defined than the near reflex. That is why sometimes there may be a lack of coordination between the pupillary reflex for light and the pupillary reflex for near. So, what is the near reflex? It is comprised of three components: accommodation, convergence and meiosis. So, whenever we produce an object or we are looking at something close by at the near distance or reading distance, we are setting off three phenomena. And the three phenomena are called accommodation, convergence and meiosis. Meiosis is a process of pupillary constriction which occurs automatically when the near reflex is set off. Convergence is when both the eyes move inward to facilitate reading or looking at nearby objects, and accommodation is a process by which the lens undergoes changes, thereby making it bulge forward in order to be able to increase the refractive index of the eye. And so, this process is called near reflex, and whenever we examine a patient's pupil, we are supposed to give the pupillary finding as whether it is brisk, whether it is simultaneous, whether it's happening in both eyes and whether it is equal. So, now the mnemonic given is pupil is equal and reactive and round to light reflex. So that is, pupil is equal in reaction, round, and reacts equally to the light reflex. So that is what PERLA means, and this is what we commonly document in case sheets when we want to talk about the pupillary light reflex.